Thank you, Mr Deputy Speaker. And today I'm providing an update on the Commonwealth's rollout of the COVID vaccine in the Shortland electorate. I should say rather the lack of a rollout, as my office continues to be inundated with calls from concerned constituents, some elderly and some in the 1A category, who have not been able to be vaccinated. The Liberals love to talk about deregulation and cutting red tape. However, the example I'm about to give of a medical practice being unable to begin giving out the vaccine is unfortunately worthy of a Yes Minister episode. Lake Macquarie Medical Centre is a few blocks from my electorate office. They lodged their expression of interest in delivering the vaccine in January and are still waiting for a site registration number. Today is the 2nd of June. That's nearly 6 months to obtain a registration number. I acknowledge that the practice did advise the Department of Health of a short deferral in order to provide their staff with the training required to administer the vaccine, a reasonable and necessary step, but have since been continually trying to get this very significant registration number in order to begin their vaccination program. After coming to my office, inquiries were made with the Minister's office. They referred us to the Vaccination Operations Centre, who provided advice that if the practice had registered an expression of interest, then a registration number should be easy to obtain. The Operations Centre then had difficulty with this and so referred the centre on to the Primary Health Network. And this is just after my office became involved. The Medical Centre did the right thing in January in registering their interest, and because they also did the right thing in training their staff, they've been faced with a wall of red tape and ridiculous bureaucracy. A medical centre not being able to administer the vaccine is a big thing in any community. But in the electorate of Shortland, the 6th oldest community in the country, it is huge, and it's not just right. Vulnerable elderly people are unable to access the vaccine because of impediments put up by this government. There are only 2 practices in the Belmont area registered. That's almost 15,000 people and only 2 practices. Never mind that the Morrison government has significantly contributed to the vaccine hesitancy because of the stupid and risky statements of the Minister for Health. But their health administrations are actually preventing medical practices from vaccinating people and stopping people who want to be vaccinated from being so. And they are giving up trying as a result. One elderly gentleman in his 80s rang my office absolutely bewildered just last Friday. He's obviously in Category 1A. His GP told him when he saw him last week that he might have more vaccines at the end of June. This is a man who wants to be vaccinated, who should have been vaccinated months ago, and this government's incompetence is stopping him and many others from being able to do so. This government refuses to acknowledge that we are in a race to get every single Australian vaccinated, and it's the health of every single Australian that's been endangered by this incompetence and recklessness.